So I know that a number of the Drug Death Task Force members are here, and you're all very welcome. But I'm also very pleased that the Vice Chair of the Drug Death Task Force for its last 6 months, when I was Chair, Fiona McQueen, is about to address us now. Fiona was until last year the Chief Nursing Officer for Scotland and brings a real wealth of experience in a practical sense from her nursing, but also in terms of policy and leadership. And personally, I want to say that I'm very grateful to her for her contribution to the Changing Lives report and the work of the task force. So I'm delighted to introduce Fiona McQueen.
Well, good morning, everyone. Thanks for your warm welcome, David. I am delighted to be here and delighted to see some new friends that were made over the last 6 months in terms of working in the task force. And what I would like to say is I'm incredibly grateful to the generosity of spirit and of sharing of information of those who were steeped in this area of practice with me when I became Vice Chair. What I've done is made the bold assumption that people who are in this room will have read the report and will have read the recommendations. And what I wanted to share with you is some of my experiences and my thinking about the last, for me, 6 to 8 months in terms of what was behind the creating of the task force report and what do I think we need to do. I think the mark of a country and the mark of an organisation when it's on a burning platform, it's not necessarily to mogar, to whine, to complain, but actually the mark of that country and that organisation is its response to that burning platform. There is no doubt 1330 needs to get to 0. And I wonder if we need to be bold and ambitious and talk about the date when we will get to under 1,000. How quickly, how fast, because that, obviously every life matters. And the longer we talk, the longer we take to reflect and consider, means that we have more and more people dying. So the old Irish man who said, well, it doesn't actually matter where you're going, I wouldn't start from here. And if you don't know where you're going, any road will take you there. I think the task force, the Changing Lives report, has given us an opportunity to pause, to reflect, a wealth of evidence which has been published, and I would encourage you to read that in your own area of practice, so that actually we can concentrate on what can be done. So yes, I think understanding where we've been is helpful. I think understanding how we got there is helpful so we don't repeat mistakes. But it could be easy to say, oh, if only, if only, if only. But what is expected of us now, as the Minister has already said, is we need to go forward, and that means change. It means perhaps being in an uncomfortable space. But I think what we need to do is go forward with a confidence that that number can be 0, drug deaths can be eliminated, and the pain and the grief and the despair that families are going through right at this minute can be stopped. No minister, no matter how good they are, can do this on their own. So, how do we support the minister sitting in Parliament, giving that commitment, listening to that commitment we heard today, to support our communities to be healthy, to be thriving, to be alive, to be well, and live life in all its fullness? And I think that is quite a wicked challenge, quite a wicked issue, but there's no doubt that the evidence says we can do it. So how do we support the Minister, and what do we need to do to support our fellow citizens instead of relying on healthcare, becoming that surgeon, becoming that nurse or that cleaner within the operating theatre? How do we support people who use drugs to transform and change their lives? The Minister talked about Police Scotland and the response in terms of naloxone, and I think they've responded in quite a remarkable way. How do we support people who use drugs instead of running from the police and hiding from the police to aspiring to be part of Police Scotland, to live life in all its fullness, to go to education, to carry out their parenting duties and be a normal, ordinary family full of health and well-being and hope for the future. And that is the key to what Changing Lives is trying to do. The number of strands. This is not straightforward. Sometimes in health and social care, it's a bit like a factory. It doesn't feel like that sometimes. If you want to go and get your hip replacement, you get your hip replacement. You've got arthritis, you have that. And actually, the treatment is fairly standardised for many, many health conditions. However, for here, in terms of people who use drugs, treatment is not standardised. Yes, we can have best practice, but the multifactorial etiologies that are brought with people who use drugs mean we need particularly skilled and expert services to do that. One of the things that shouldn't have surprised me, but it did surprise me when I took up the Vice Chair's role, was how many arguments there were. And the Minister's already talked about it. Is it abstinence-based recovery or is it harm reduction? It was curious. I had never experienced that before in my professional career. Such conflict, and it bothered me. It's not healthy for the people who are working in that sector, and it's most certainly not healthy for the people who use drugs. So some of it was actually just, David didn't see things quite the same as me, and I didn't see things quite the way as him, but it probably didn't matter. But some of it was actually, no, the earth's flat. It was absolutely entrenched positions, and nothing else would do unless that happened. And what bothers me is, actually, whilst we're having these arguments, almost fiddling while Rome burns, we're wasting our time and we're not concentrating. And I began to wonder, is it about finance? If I diminish abstinence-based recovery and residential rehabilitation, that then means I can get more money for my service. I don't know. I think that has to be part of it. But what I also found was an amazing sense of willingness, of love, care, empathy, compassion, to do our best, to do our very, very best to eliminate drug deaths, to eliminate overdose, to reduce risk, to reduce harm. And a passion and a commitment to go and do that. Yes, there are problems in terms of, where are we going to get the finances from? And gosh, since the Taskforce report has been published, the country has even more financial problems. But what I think is incredibly important is to concentrate on what we can do. And I think there's a lot we can do. Yes, I think more money is needed. However, we also need to concentrate on moving forwards and taking things in a way that works together, helps people, and creates that environment where one day, and those of us who are old enough in the room can think back on many things and remember when there were no mobile phones, when there were no hair straighteners, when you used to have to go and get your stomach cut out if you had a bleed instead of now buying some etidine at the pharmacy. One day, we will look back and say, remember when we had drug deaths. They are the thing of the past. So, the strands, I think, the context is important for us to reflect on so that we move forward, so that we respect the hurt, the despair that people have experienced, the frustration. Cultural issues are huge. Those of you who work in this sphere will have been asked, why would you want to work in drug and alcohol? Could you not get another job? And your answer, of course, is because it's an amazing, fulfilling, important job that breathes life into my professional practice. But we have real cultural problems. The care and compassion that children with cancer or people with other long-term conditions receive should be the same care and compassion that people who use drugs receive. And then that complexity of needs, whether it's problems with liver, problems with substitute prescribing, problems with mental health, problems with skin, how do we manage to weave these services together? And that's what I think we need to concentrate on. So in terms of the thinking behind some of our recommendations, lived and living experience needs to be at the very heart and the very centre of policy creation and service provision. There is no doubt about that. We need to stop creating services that people who don't use drugs, even people who work in the service, think's the right service. So that's why it's a key and fundamental recommendation for us that need to be at the heart. The answers are there. We need to listen and find them. And answers are often in families as well. So that important role that families have to play in supporting people who use drugs is absolutely critical. Their well-being is important in terms of supporting them, because they live in very, very complex areas where they're trying to support a loved one who uses drugs. But also they're critical in many times in keeping that person who uses drugs alive. Wow, the accountability. That's a real issue for us in terms of where is the accountability for that whole complexity of service, third sectors, volunteers, health, social care, justice. And we were keen that that accountability from minister right down to service user, but through the chief officers and through people who should be accountable, is made clear, and people are held accountable for that delivery. Clearly in a supportive way, but actually it's going to be one of the critical factors, I think, for success. And this no wrong door. We all know the stories of people turning up and being told, have you made an appointment? No, well, you'll have to go away, you'll have to do an e-consult, you'll have to phone, and then maybe you can come in to see the GP. That no wrong door. This is so fundamental and critical. It gives life-saving treatment, but it's also affirming to people who use drugs that actually they are valued, they are loved, and they are cared for. Let's not keep pushing people from pillar to post. And I think the skill for people who work in specialist services, but also who work in generic services, there's a multifactorial etiology around people who use drugs. And that, the plurality of response that's needed, needs to be based on the values and vision and needs of the person who uses drugs. Not the paradigm and the values of the current services. And I think we can do this. This does not cost money. It does not cost money to treat people with compassion, to change the way we run services, and that, I think, will make a huge difference. Naturally, and we couldn't not have our Changing Lives report without talking about prevention better than cure. We know that, and we know that the government is committed to making that happen. It will prevent a whole host, whether it's gender-based violence, use of drugs and alcohol, but we know that early intervention is key and critical. And services do also have a role in how we take that forwards. We talked about service specification. We're recommending a national service specification. At the moment, there are some fantastic services, but what we want is every citizen in Scotland not to be able to access the same service, because the service that you need on Barra is quite different from the service you need in Perth. But actually, we need to have a national specification and hold people accountable for actually delivering that service. And we need to treat it as it is a public health emergency. If we look at even the public's attitude to COVID, it was accepted that things needed to be done because we had this public health emergency. I do think culture has a big part to play in it, in terms of why should we, but why shouldn't we provide services, both in terms of funding, but also in terms of that rapid response. Some of you will have been familiar with the NHS Near Me service, which was the video service for consultation. And in my previous role as chief nurse, if I was out and about, whether I was at Orkney or Shetland, and I would talk about, if there's one thing that you could do that would make a difference, and this is pre-COVID and out with drug and alcohol treatment, they would say, well, actually, for some of our residents, they have to take 3 days to go and see a consultant in Aberdeen for a 20-minute consultation to tell them they're fine. Overnight, practically, with COVID, we started using video conferencing. So we know that our big lumbering bureaucracies can change and can be fleet of foot. And what's needed of all of us now is to have that level of expectation, have that level of demand, that services will not take forever to change and to morph. We need to make sure that we're doing that, and we're doing it in a sensitive way. And that services, just as our healthcare environment inspections for hospital cleanliness, just as our inspections for older people and our inspections for neonatal units and the inspections for social care areas. We want to have services for drugs to be standards set and monitored and look at publicly making sure that they are taken forwards. Similarly with the justice system, we know the complexities that live here. We know that people within the justice system and within prison who interact with our team Police Scotland are often there because of reasons of trauma. And we know that work is going on, but that also has to continue to change with a trauma-informed approach so that we can remove people from the justice system who need care and compassion. We need to create the conditions that people can thrive and not get into a life of crime that then can really set them back because it precludes them from jobs, from moving forwards with their lives. And oh my goodness, stigma. The stigma charter the Minister talked about is so important, but lifting that stigma means that people will stop dying. It will prevent death. But what it also will do is, for people who are bereft because their loved one has died from a drug's death, the grief empties them. They're ashamed and embarrassed and can't grieve properly within their communities. Lifting stigma doesn't necessarily cost money. As a society, we have a moral obligation to be confident about our fellow citizens and the care and love and compassion that they need. Another recommendation was that each individual, where there were particular needs, it may well be that there are particular services. I think we can go a long way in providing person-centred care, but actually it may well be that women and girls, LGBTQI people, have challenges accessing services, people from ethnic minorities. So we need to make sure that services are bespoke to particular groups who find it difficult to access services. And the whole thing about reviewing drug deaths, what we're recommending is that every single drug death is reviewed. It will feed into that accountability line within sectors, however we divide up our country, and make sure that we learn, really learn. So that means data for learning and improvement, not for judgment. But every drug death, the way we review perhaps every stillborn or death or every neonatal death, we need to review every drug's death and learn from it and give the support to the people who've cared for that person, but also their family. And yes, there are differences between Westminster and Holyrood. And we know that the government is working incredibly hard to try and find ways that we can implement what needs to be implemented here in Scotland. And I know that the government will be continuing to work with Westminster to try and make changes that are suitable for a modern, contemporaneous society that we have here in Scotland. But what's expected of us now is not to fret about that, not to say, if only. So yeah, if only we weren't here, things would be a lot different. But let's not focus on what ought to have been and use that as a reason for us not going forwards. We need to accept that it's there, work around it, and find solutions. And whilst I would never say, and I would like to be bold and say, when do we get under 1,000? Is it 12 months, 18 months? We need to have a confidence that what we are doing now will make a real difference. And in Raiders of the Lost Ark, when Harrison Ford gets to the end of a tunnel, he's running, and he looks out, and he's told there's a bridge. He doesn't see it. So he steps forward with confidence, and that bridge appears. And that's what we need to do. We need to have a confidence that within this room, around the country, are people who can make that very practical and tangible difference. Whether it's delivering services, whether it's leadership of services, whether it's policy formulation. We know that working together, and I believe if we were to implement all of the recommendations from Changing Lives, we could eliminate drug deaths. So I commend it to you. I thank everyone who has worked hard and been keen to make sure that we take things forwards. But also, I would urge us all to have a confidence to change, to embrace what needs to be done, and have a knowledge and a confidence that we can make that difference and eliminate our drugs deaths for once and for all. Even if it does take time, we need to make sure that we're starting to work on it now and take things forwards for the future. So thank you very much indeed.